Module 5, Social Determinants of Health. Learning Outcomes. At the end of the module, students should be able to: number 1, understand what are the social determinants of health. Number 2, identify social determinants of health in the elderly. Number 3, understand how social determinants of health can affect the lifestyle choices. Number 4, propose solutions that could improve health equity. Before we get started, take a minute to reflect on what determines health for you. Defining social determinants of health. According to the World Health Organization, social determinants of health are non-medical factors that influence health outcomes. They are conditions in which people are born, grow up, live, work, and age, as well as the systems put in place to deal with illnesses. These forces and systems include economic policies and systems, development agendas, social norms, social policies, and political systems. Why are social determinants of health important? Research shows that these social determinants can be more important than healthcare or lifestyle choices in influencing health. Numerous studies have shown that social determinants of health accounts for between 30 to 55% of health outcomes. Categories of social determinants of health. There are various categories of social determinants of health, and this includes economic stability, social and community context, neighborhood and environment, healthcare, as well as education. Another way to look at it is from a micro to macro perspective, from individual and lifestyle factors to social and community networks, followed by living and working conditions, and lastly, socio-economic conditions. Let's explore some examples of social determinants of health from each category. Firstly, economic stability. People with stable employment and income are less likely to live in poverty and more likely to be healthy, as they are more likely to afford medical bills or treatment, thereby improving health outcomes. Neighborhood and physical environment. Our housing type can affect our health. For example, a family living in a one-room flat versus a four-room flat. The amount of privacy as well as space to rest can vary and can have effect on our mental health. Other examples would be accessibility to parks as well as exercise facilities. This may not be relevant to Singapore, but in other countries, certain neighborhoods may have exposure to high rates of violence, unsafe air, or even water, which can affect our health. Education. With a higher level of education, individuals tend to have better health literacy and better ability to make more informed choices. The level of education also affects one's employment prospect as well as income levels. As for food, the access to healthier food options will have an impact on one's health. On the reverse, the lack of access to food in general, hunger, can lead to nutritional deficiencies as well as malnutrition. Community and social context. People's relationships and interactions with family, friends, neighbors, and colleagues can have significant impact on their health and well-being. Discrimination or bullying at one's workplace or in school can also affect one's mental health. As for healthcare system, people without insurance are found to be less likely to have a primary care provider, and they may not be able to afford the healthcare services and medications they need, for example, preventive care and treatment for chronic illnesses. Based on the examples listed previously, we can see the interaction between various social determinants of health as well as its impact on our health. Social determinants of health can influence health in positive and negative ways. The links between different factors that influences health are complex and integrated. Addressing social determinants of health is important for improving health and reducing health disparities. Now let's move on to a case study. Here we have Mr. Ong, a 68-year-old Chinese male whose highest education level is undergraduate studies. He works as a manager and lives with his wife and children. We also have Mr. Tan, another 68-year-old male whose highest education level is primary school education. He is still working as a part-time cleaner and lives alone in a rental flat. Both Mr. Ong and Mr. Tan learned about colorectal cancer screening using fecal immunochemical test (FIT) recently. The FIT is a preliminary test that detects the presence of small amounts of blood in feces from colorectal polyps and cancers. Mr. Ong learned about colorectal cancer screening through his friends and the internet. He subsequently made an appointment with his general practitioner to do a FIT. Mr. Tan, on the other hand, heard of colorectal cancer screening from his GP during a clinic visit for cough. However, he decided to wait another year as he was worried about losing income when he takes time off. Moving on to 5 years later, Mr. Ong continued regular colorectal cancer screening, and 5 years later his FIT came back positive. He was referred to a surgeon for colonoscopy, which found polyps and he had them removed. His wife and children were supportive during his recovery phase. Mr. Tan, on the other hand, did not start his routine screening and eventually developed symptoms such as blood in his stools. He was referred to the colorectal surgeon by his general practitioner. However, Mr. Tan was concerned about affording specialist consultation and subsequent surgery. He did not know who to turn to. Based on the previous scenarios, are you able to identify the differences in the social determinants of health? Here is a recap of the various categories of social determinants of health. Here we have selected income, education, as well as support systems. Through this case, we can identify at least 3 social determinants of health, as circled in the previous diagram. Firstly, education. The differences in education level affects their ability to make informed decisions and also their ability to comply with medical recommendations such as age-appropriate cancer screening. Secondly, financial status. Their financial status affects their ability to afford health services and thus accessibility to health services. Lastly, social. Psychological support plays an important role in influencing our health-seeking behavior. Moving on, what are some existing policies in Singapore that help improve health outcomes? Firstly, we have the Screen for Life, which provides highly subsidized chronic disease and age-appropriate cancer screening. Moving on, we have the Health Promotion Board, which conducts health screening in school students and promotes health education. There are also multiple tiered health subsidies available for various populations, such as low-income families and elderly from pioneer generation. Lastly, we have ministries such as the Ministry of Social and Family Development, which oversees our policies, community infrastructure, and services. In the community, we have multiple resources available to improve health outcomes, and TriGen is one of them. TriGen seeks to mitigate some social determinants of health by providing holistic care to vulnerable elderlies through an intergenerational approach. Our vision is for every elderly in Singapore to experience the protection, care, and love of a family. Through our work, we hope to target the community and social context, as well as the healthcare system categories of social determinants of health. In summary, social determinants of health are non-medical factors that influence health outcomes. This can result in positive or negative health outcomes. And lastly, healthcare policies and other social and community resources can address these social determinants of health to ensure better health equity across all groups. We hope that you have a better understanding of the types of social determinants of health as well as their influence on health outcomes. It is now time to test your knowledge with a quiz. Please scan the QR code or use the tiny URL on the slideshow. Finally, here are some resources you can check out to learn more about existing community healthcare policies and services.